Okay, this is Dr. P here, and I'm here with John, who is 4 years out, a little over 4 years out from our one of our knee repair, not knee replacement programs, trademark programs. And this is Dr. Zach Kaplan, who just happened to be walking by, and he helped with the rehab for John, and I'm sure John's still doing all the exercises that you taught him. But being 4 years out, I like to check on these patients and see how they're doing, once a year. But going back a little over 4 years ago, what was life like for you back then, John?
Well, back then, it definitely had issues with my left knee. I mean, I was feeling pain in there quite a bit.
What things were you not able to do that you wanted to be able to do again?
It interfered with my golf sports, which I enjoy doing.
Yeah, are you golfing now?
Oh, yeah.
You've been golfing yet this year so far?
Not yet this year. I mean, it's waiting for a little better weather.
Gotcha. Okay. So what is life like for you now, or what are the results been from this program?
Actually, now it's actually, I mean, I could say 90% better than what it was 4 years ago.
Awesome.
It seems actually like it's getting better. I know guys that had knee replacements. I think doing the physical therapy though does help, because last year my left muscle, when you measured it, it was not as big as my right.
It's the same
and
size
now
this
it's
year.
the same size.
So that speaks to what Zach taught you. I always tell patients, try to do your exercise every day if you can, with at least 3 times a week forever.
Right.
So how would you speak to going back and remembering where John was before and where he's at now 4 years later?
Having an individual trust the process and being motivated about it is probably one of the bigger factors in success. Really, we can do our job, but having you come in and say, hey, doing the work, I'm able to do the work, I want to do the work because you were motivated to get better, that made our job a heck of a lot easier. And I know because of that, I think we were able to expedite that process and improve the efficiency of it, just because of your outlook on it. So, that plays a huge role in it. So we really appreciated that.
Oh yeah,
I know
because
that.
back then you even said I actually was way ahead.
We almost had to pull the reins back on you a little bit. I remember
being a hard worker, being all in. It's really, really important. So if you had to give some advice to people who were in a similar situation to what you were like 4 years ago, and they're on the fence of going through with something like this and avoiding, we were just looking at this knee replacement. They want to avoid the metal, plastic, and cement. What advice would you give them?
That's definitely what I want to avoid, because surgery is like the last thing in my mind. So, what you had done definitely helped. It was big.
As we talked about, it was a team effort, and great job.
Yep.
And we're glad you've been able to reach your goals, and hopefully you made a hole-in-one since then.
Hopefully it gets better.
All right, yeah. All right.
It doesn't get any worse. It hasn't, so.
Keep doing your exercises, keep golfing.
Yep.
Awesome.
keep golfing.
Yeah. Keep
My man.
golfing.
Nice job.
Take care.